Now, question, is it possible that coupled organs do not have the same picture of imbalance? Could it be that stomach has excessive yang and the spleen is cold? The coupled organs, they have internal meridians through which energy flows to and fro. Since in the interior the climate is similar, we say that as long as energy flows from one to the other organ, they will have a similar picture of imbalance. But it is possible that because of internal blocks or surgical scars, that the energy flow in the interior is obstructed. If so, it is possible that coupled organs have different pictures of imbalance. It is therefore necessary to tonify or sedate them individually. So another question, many books say that energy flows from the Luo point to the Yuan point. So actually, this requires a very difficult. This is a little bit difficult because there are books that do not agree with some teachings. No, so which way does the energy flow? Western textbooks on acupuncture seem compelled to specify the direction of energy flow between the coupled channels. However, none of the classical Chinese texts specify the direction of energy flow, nor do they state whether energy flows from Yuan to the Luo point or vice versa. Chinese medicine is derived from practice and empirical knowledge rather than based on logical deductions. It is stated in the classics that a Luo connecting point connects the two coupled meridians, but not exactly the why and how of it. If coupled organs are diseased, it is customary to use the Yuan source point of the first diseased organ and the Luo connecting point of the second affected one. The simple name source point suggests the energy flows out of this point and into the connecting one. So we should look at how the Luo connecting points are used in symptomatic prescriptions. Example, point stomach 40 for excess mucus or edema, reduces mucus, decreases yin. Point gallbladder 37 for bright sight, improves function, increases yang. These are not generally used in combination with Yuan source point of the coupled organ. These increase the yang of the yang organ, so there must be points where the energy enters. Example, pericardium 6 is a universal calming point and is used also against vomiting and tachycardia. Lung 7 is not only used for the lung, but as the confluent point of Ren channel to influence the yin of the whole body. These 2 points make the person very yin. Again, the Yuan source points of the coupled organs are not used, as the use of PC6 and lung 7 makes the person more yin. They must be points of entry. Energy flows from Yuan to Luo, and in most cases, it is sufficient to use only the Luo connecting point of the deficient organ. That is, if the yin aspect is weak, use the Luo point of yin organ. If the yang energy is weak, use the Luo point of the yang organ. So Yuan source points of yang organs and the Luo connect points of yin organs. So spleen is the only meridian that has 2 Luo collaterals and 2 Luo connecting points. So we sedate Li4, okay, to affect the lung 7. We sedate the triple warmer 4 to affect lung 6, pericardium 6. We sedate Si4 to affect the heart 5. We sedate bladder 64 to affect kidney 4. We sedate stomach 42 to affect the spleen 4 or 21. We sedate gallbladder 40 to affect liver 5, and no Yuan points on Du channel, Ren 15. So this imbalance could be in a yin or its coupled yang organ, and the same combination of points can be used. Both spleen 4 and 21 are used in situations where the yin is deficient and the yang high in either the spleen or the stomach. If the symptoms are in the periphery, for example, dry inflamed lips, spleen 4 is used. If the symptoms are in the interior, as in chronic gastritis, then spleen 21 is used as it is located closer to the stomach. Example, kidney yin excess and yang deficiency. Symptoms, generalized edema with little urination. This shows weakness of kidney function as it is an organ that eliminates fluid. According to their interior relationship, coupled organs have the same picture of imbalance. So treatment, sedate kidney 3. We sedate kidney yin directly and urinary bladder yin indirectly. Tonify bladder 58. Tonifies urinary bladder yang directly and kidney yang indirectly. Okay, so that we arrive at this new balanced state for both organs.